All right, thanks, guys. Here are some formalities we need to carry out before giving a talk. Yes, formally, I do have financial ties with SYY Integrated Health Systems that teaches health practitioners and trains them in implementing this system in their practice. Okay, so FCT in applying principles of complexity and laws of system in the treatment of mercury toxicity and associated chronic diseases. Now, it looks a little like a complicated, and the thing is why we're making kind of simple things complicated. The problem is that simple things are not as simple as they look in real life. Concerning mercury toxicity and the treatments, I'm not going to be a priest preaching to a choir how bad mercury is. I think you all know it probably better than I do. All right, the question is what to do with the situations, which probably some of you have, but I encountered many times in my practice. And it started with my journey as alternative practitioner many years ago. Being trained in chelation, detoxification of just heavy metals in general, mercury in particular. And then everything was going well. Looks like people were getting better. Then one of those days, one of my patients comes in a month later after I chelated him for heavy metals and mercury and says, you know, doctor, I mean, this looks like a great treatment, but for the last 30 days, I haven't slept a minute. So he suffered severe insomnia for 30 days. Was on the verge of nervous breakdown, naturally. Was a very nice man, was husky, robust police detective. And I felt very bad, but I didn't have a clue what to do and how to undo it. Then other cases I encountered was just people would complain of long-term chronic problems with various symptoms, just following urine provocation test with mercury chelators, heavy metals chelators. Then I encountered a patient who said that after someone else chelated him for heavy metals mercury, he said, I felt like I was dying. And when he came to see me, he still felt like he was dying. The results were permanent pretty much. No one could undo it. Then he went to, he said, to get a treatment in what's considered to be best European alternative clinic in Europe. And there he, during a treatment, he went into hypotensive shock, was delivered to a local hospital, an emergency room, et cetera, et cetera. Okay, then I had another patient, a medical student, father MD. They paid $100,000 out of pocket for mercury detoxification program with one of the renowned doctors in this field who teaches this method. The boy ended up with hepatitis, pancreatitis, and zero improvement in his overall health. So surely things like that require, prompt us to investigate things and think of things, what went on, and look into scientific literature, medical literature. So I started doing so. And following this and following years of experience in mercury detoxification with my method, I wrote an article about potential benefits and dangers of chelating mercury and other heavy metals. In this article that is extensively referenced, it's not just out of my head, I just reported clinical experience, observations, but then I found quite convincing body of medical literature saying that, you know, just chelating heavy metals, it's besides being a good idea, also carries its own risk. Here's a documented potential dangers and iatrogenicity in toxicological literature concerning a metal chelator. Insufficient penetration to the cells due to poor ability to cross the lipid portion of the cell membrane. Poor penetration of blood, brain, and spinal cord barriers. Poor penetration to the organs with high fat content, such as bone marrow, brain, spinal cord. Part of their binding capacity is also consumed by body metalloids. Not too many of us appreciate that we call minerals and trace elements, they're metals too. Strictly speaking, from the point of view of chemistry, they belong to metals. They're called metalloids. So chelators also bind them, which also undermines their dependent physiologic function that ties to thousands of enzymes in the body. Also, chelators and complexes have limited penetration to the bones, including teeth, jaws, and sinuses, and also lungs. Chelators mobilize the release of toxic metals from organs and tissues by forming toxic complexes without any control over redistribution or so-called dumping effect, leading to dumping effect of these complexes into other organs. So the toxic effects were registered at the cellular and chromosomal level. Likewise, these complexes may lead to uncontrollable overload of already impaired excretory organs such as kidneys, large intestine, as well as detoxifying organs such as liver, and can be certainly dumped into any organ from brain to toe. Even lower dose of chelators cannot sufficiently preclude their potential side effects. All right. So the question is how to do it. How we go about this, harnessing this process. On one hand, we need to get these poisons out of the body. On the other hand, how we're avoiding making sick people sicker. Let's go to the end. So that led to also to a search of different means of depoisoning the body from mercury. One of them...
Which chelating agent are you using?
I'm sorry?
Which chelating agent are you using?
I don't use any chelating agents. Oh, before that we were... yeah, I don't want to mention them. People may get upset. DMPS, DMSA, EDTA, glutathione, lipoic acid, and the list is long. I did not use them all personally because at some point I realized the danger is just adding more chelators. But I used some of them, and those kind of victims of these treatments, they came to me where other agents were used. Did I answer your question?
The usual ones from the 1980s.
Yeah. All right, so general system theory was helpful in the way to number one is this book realized that number one is that the body works as a system, okay? And everything is being processed there as on a systemic level. And two is again, this refers to so-called complexity, concept of complexity. This is a quote of Harvard biology professor Edward Wilson. So showing that even, the conventional science, some of the more enlightened conventional scientists realize the importance of complexity in medicine and biology. So they're saying complexity is what interests scientists in the end, not simplicity. But most of the scientists have never heard of it. Again, here in this book, again, the emphasis is made that particularly in health sciences, there is innate resistance to integrating new concepts, particularly complexity, because it is very intellectually demanding. Unlike conventional medicine, pharmaceuticals, that drug A treats some kind of a condition B, which is often copied in alternative medicine, even though through many, many agents and through different therapies, but it still boils down to A to B. If you do many, many A's to B's, it doesn't make it systemic. It doesn't make it acting at the system level. It only makes it act at many kind of simplistic linear levels. So next, but also as we show it in the next, okay, this is simplicity. A chelating agents acts against B, mercury, or other metal. But this is actually how the body is processing all the treatments, conventional and alternative, at a systemic level. And even though we have very nice ideas and benevolent intentions to help patients. The body cares less about ideas, the science cares less about ideas and patients and our interests and our desires. It pretty much, it does what it does. That's how it processes. So something that could be good for this cog or this cog wheel may destroy the next cog wheel. All right. Next. One of the things also complexity would lead to, as we show it in following slides, talking about system biology, is or laws of system, is that it also offers different levels at which our physiology functions, which is energetic and level of physics, where we can also conduct many treatments, and if we do them skillfully, we can bypass many these pharmaceutical icebergs. So icebergs that so-called mechanistic or chemical medicine presents, where they just isolate some kind of abnormality and problem and say, let's address it this way. All right. So we'll get to it in a minute. So here, over the years, I have worked out this three-stage process of detoxifying mercury and doing it as safely as possible and as effectively as possible. One, before we start replacing mercury, okay, which naturally leads to well-known potential side effects and danger of releasing more mercury from the phalanx and having a patient inhale, ingest, and absorb through his even saliva more mercury, we need to show some concern and look into the state of his excretory, detoxifying, and any other impaired organs. It could be brain, it could be ovaries, it could be brain, could be pancreas, could be any organ. However, the problem here is that laboratory tests are extremely unreliable in this respect. It doesn't matter how much mercury you find or don't find in urine tests and blood tests, saliva tests, hair. It doesn't give us the most important information, what's happening in the internal organs. Okay, this quote is from a textbook of toxicology of metals. All right, so basically they are saying the accessible tissues in the living may not be those that most accurately reflect the exposure to metals. All these tests have very limited value, and basically the ultimate diagnosis can be only made after it's a little too late, at post-mortem examination. All right, now, in relation to this stage one, okay, another concrete example, at least for my brain, I remember best clinical examples, okay? Someone can flood you with 5,000 scientific references. It's not easy to remember. That is for me. I remember key. But if I know clinical example, I'll be able to find those references, relate to them very easily. Because in medicine, you can justify just about anything. There are millions of variables, millions of findings, millions of abnormalities, and you can justify any treatment to treat something. All right, the question is their weight. The weight and the meaning of intervention, how effective it is, how safe it is in the end. So here I'll just give you one example, why it is important to do this, what the stage one says we need to do. So many years ago, I had this patient who said she's going to go to the office of late Dr. Hal Huggins, okay? God rest him in peace, and all the credit to him for making us all aware of, through his book and presentation of mercury toxicity. He was a significant contributor in this stage. But he couldn't avoid the limits of basically biochemical pharmaceutical interventions that he was practicing himself in the process of removing mercury. So by that time, I already was able to implement biophysical bioresonance testing into my practice and the treatment that we're going to elucidate in a minute. And when I tested this woman, I said, you're not ready for it. Your immune system won't be able to handle it. Your kidneys are too weak. You're looking for a crisis. And she said, no, my friend is going, I'm going to join her. And the clinic said they take all kinds of precautions there, and vitamin C, and they do this at the same time, and that at the same time. I won't go into details. So she went, I said, your friend, she was also my patient. I said, she's ready, she can do it, but you are not. Don't do it. Anyway, the friend went through this well with flying colors. This woman, who I told her not to do it, right in the chair, she started going into anaphylactic shock and was brought to an emergency room, all right, after that. Certainly, occurrences like that do not help anyone's liability situation, neither dentists nor doctors, okay? So that was one of those lessons. Okay, hold on, what am I doing? I'm doing this. So some aspects of system theory biology is that that the living organism is so-called open system, and the essential point of open system is, a living system is that basically they exceed the limits of conventional physical chemistry. And the biophysics or the application, this is misprint, sorry. The application, the text said the application of physics. So, sorry, my secretary misprinted it. The application of physics to the living organism is necessary. So we'll see which physics and how to do it. So one of the ways of implementing physics in our practice is taking advantage of its simple tenets and principles. That is, each matter, okay, it doesn't matter my nose, your eyes, this vial, a piece of metal, okay, exists in dual form. One of matter that we can see and touch and smell, right? But the other one of energy field, which actually, the actual blueprint of the matter. The energy field determines identity of each matter, whether it's going to be liver, heart, lung, or whatever else, okay, or toenail, and it serves as its ID card, okay, as a fingerprint. It's called natural resonance frequency. So what we can do is, through this conductive circuit, we're going to show it to you in a second, its continuation. What we're doing is, so we're putting this vial, whatever you want to check. You're interested in patient's kidney before we start removing mercury, brain, the entire body, all the organs. So we can interrogate them through these vials made of homeopathically prepared, let's say, organs. And then once we elicit stress response, by the way, this is a part of applied kinesiology, but it's completely non-force, involuntary. So as I show you later, it is void of any kind of a technical subjectivity, where you have to push on people's muscles, pull them, and then you have to worry, are they tired, are they not tired? Are you over-pulling, over-pushing because you're just being subjective? You think they ought to be allergic to gluten, let's pull a little harder. Okay, or they ought to have mercury toxicity, we'll pull a little harder. So anyway, and then we monitor their involuntary reflex. Okay, I don't want to go into technicalities right now. I want to go on principles. We train on it. If you're interested, we'll go into technicalities. Next. So this way, by putting a certain number on vials on this platform, okay, made of mercury infectious agents, whatever, root canals, brain, whatever, arsenic, lead, we can communicate with any organ in the body and find out their state. Hey, are you poisoned? Are you poisoned? Are you functioning well? Maybe you're not poisoned, but you're just not functioning well. And therefore, in the process of mercury detoxification, that organ, let's say, could be spleen, or could be liver, will be particularly vulnerable, or testicles, or breast, will be particularly vulnerable to being mercury deposited there, or other toxic metals. Okay, next. Okay, this is kind of it's my old-fashioned, what I call, used to be slides. So here, this is the circuit plate, okay, metal plate, so it's a good conductor, conducting cable, good conductor. Patient is holding a metal bar, good conductor. The patient is sensing energy field of any substance we put there. Vial, you can put chelator there if you wish. You can put dental material there if you wish. Check for compatibility. So that's the bottom line. And from there, through series of answers, through muscle testing, yes or no, we determine, we kind of mapping the patient's entire system, where mercury is, how many organs are impaired, and then how therapeutically to address it, strengthen the patient during stage 1 preceding the replacement. Here it's a more crude, more subjective, more force-oriented methods of applied kinesiology that I don't advise to use. Okay, here through a bunch of all these vials, okay, head to toe. We also have many infectious agents. We treat root canal. About 90% of root canals don't require any removal of the phalanx. We can cure it this way. Infected root canals, old root canals. Next, there is also EAV, computerized testing that exists, and people think that just because it's a computer, it has to be flawless. That's not the case. Okay, here just it's a leading computer scientist, Professor Minsky from MIT. He said what it is. No computer is ever designed that is ever aware of what it is doing. Most of the time, we aren't either. Come to think of it, if computers could do everything by now, we would have had no fossil fuels left, okay? Would have replaced them with water. We would have had, everybody would have been billionaires because someone would have designed such a smart computer software, would always be making killing on the stock market, and we would have solved many, many other problems, whether it's a social, technological, medical, cure for cancer and everything. So computers are as smart as people who programmed it. Speaking of myself, personally, once I tested one of these devices many years ago, and I was considering of purchasing it for myself in my practice, absolutely correctly, the practitioner determined I had a lead toxicity in my kidneys because I came from Russia with a lot of lead pipes, old houses, poor EPA regulations, a lot of lead, pollution, etc. So she gave me one of those remedies that the CAV suggested, drops, and that almost killed me. I had such excruciating pain in my kidneys. I couldn't get off the bed. I was crawling on the floor to my own causative homeopathy, and when I took proper remedy for kidneys, I was able to walk again. Okay, next. Okay, here, then there is another treachery, a trap with complexity, okay? Only because we test and we do some interesting testing doesn't mean that we can always find with something, come up with something meaningful in terms of diagnosis. It holds true for all the testing, my testing too, or treatment. There is this thing concerning, talking about physics, this devious Einstein-Podolsky-Rosen paradox where the brain of people can exchange information via energy fields. I'll give you another example. Many years ago, I had a training in my office, and one of the students was a biological dentist. So I said, okay, test my patient. He tested through my method, and he was my student. And he diagnosed correctly, patient suffered from mercury toxicity. I said, fine, give him the treatment. He wasn't quite versed in my treatment yet, protocol. So he brought his own chelators he uses in the office. He put them on the plate, and the patient accepted them. He said that this is a wonderful treatment. I said, fine, let me retest the patient, and retested them, put my treatment on the platform, and the patient also accepted them. All right. Then I had him come back. I said, please put your treatment back, and then after that, put my treatment back. All right. He put his treatment, and the patient immediately rejected it, yet accepted my treatment, causative, I call it causative homeopathy. Why? Because the patient brain is connected to the practitioner brain, and he's going to this, hey, is this real good, or is it just better than nothing? He said, if it is better than nothing, I'll say yes. But that doesn't mean this treatment, only because CAV said so, applied kinesiology said so, it's really necessary a good treatment or even safe treatment. So there's a lot of treacheries in this testing. You just need to know how to avoid them by having the right algorithm. Okay, this thing, okay, here again, we're not jumping, guys, exactly on the bandwagon. 1999, right, 20 years ago. So I have this baby here. I already started practicing, was like 5-6 years into this. So I have this baby. It looks like has a crocodile skin. He's covered with disfiguring rash, dermatitis from head to toe. I treat him with my method. he greatly improves. And then his wife said, but he's not holding. And then he improves, clears, and then he gets dermatitis back. Went like that couple of times. Then I said, Mom, give me your breast milk. She was still nursing him. I'm putting milk on the platform, test against the baby. He adversely has intense muscle reaction against the breast milk. Then energetically, I match the breast milk with various toxins, including mercury, and mercury matches it. So I said, Mom, your breast milk likely has mercury. Do we have fillings? Yes. Some of them even might have removed fillings, but even before pregnancy, but it would stay in the body still. Making a long story short, I decided to document it. I sent that breast milk sample to a lab, okay? Here what you see, mercury, 99 whatever micrograms per liter of mercury. This is what that baby was sucking in every day. Now, this goes, the concept, however, take us beyond this baby. The concept is, and it's also documented in scientific literature, if all kids from this age are already born with mercury, number one, suck in mercury, where it's going to go as they grow? So what's happening from there? From there you have sick kids. Now they may not have this type of a presentation. They'll have different. They have ear infection, tonsil infection, throat infection, sinus infection. They're hyperactive. They had side effects to reactions to vaccines. They have bowel disease. They have this condition, that condition, ADHD, etc. But no one knows what it is until you start testing internal organs. So from here on, I got an idea that it looks like the better we become at detoxifying from mercury, the better results we're going to have with all diseases, because the poison is multisystemic and can go to any organ and cause any disease, from brain to toe. Okay. All right, how do we treat? There's only one treatment, only therapeutic modalities that gives us this necessary specificity and depth. It is homeopathy. Why? You can make a poison out of anything, okay? Such as whether it's arsenic, mercury. This is documented, it's in my book. Documented biological effects of homeopathic remedies, detoxifying toxic metals, chemicals, other poisons, pharmaceutical poisons, radiation, mushrooms, infectious agents, and also ability to restore organs. Okay, here is interesting research study by European scientists that it doesn't have to be homeopathically made remedies. It could be even digitally prepared remedies. So as long as you improve, because water is an excellent semiconductor, and you can, basically water, think of water as CD. You can inscribe anything in water. Music, any music, any information, any voice, movies, whatever. Right? So it doesn't have to be classical homeopathic remedies, because classical homeopathic the manufacturers, they're not really that versed into this type of medicine. They're more into Hahnemannian, old-fashioned type of homeopathy. Okay, next. Okay, here some, we're going to clinic now, all right? Some of the effects, okay, here are the worms, right? This woman was number one detoxified of mercury, and number two, I found worm infection, and here she's sending me photos of worms saying, okay, hi, Dr. Yurkovski, I'm attaching photo of worms released from my intestine such and such day, 2 days after I finished my remedy for this month. Okay, so the effect is real. Okay, now another worm came out. I never heard of it, but I think it's possible because I found this worms in the brain of this child. He was treated for pandas, Tourette syndrome, many brain-related problems, unsuccessfully by immunologists, infectious disease specialists, many antibiotics, alternative treatment didn't work. This is email from his mom. Okay, from the nose. So following the worm remedy, okay, later, Chris Worm, I Okay, it landed on the white label of the washcloth. He felt vibrating in the nose before sneezing it out. Okay, so please share it with the doctor. Many thanks. Looks like a worm. At least, even if it was a mucus, I never heard that mucus would be vibrating in the mouth. 10 minutes? 20? Plenty. All right. Good. Okay, so stage 2. Now we're going to stage 2. So following of mercury removal of the silver amalgam fillings. So stage 2, following optimal detoxification and strengthening of the excretory, detoxifying and any weak organs of a patient, he's referred for silver amalgam filling replacement. So when I do that, I'm still concerned about also in relation to gravity of a patient's condition. Someone has cancer, someone has brain tumor, someone has Parkinson's disease. Someone is not that ill anymore. They made good progress, etc. But here still, with the conditions of severe gravity, I'm concerned about touching more than 2-3 small fillings at the time, or medium-sized fillings. Must always be followed by a prompt within 24 hours retesting, while in treatment in anticipation of more mercury release from the fillings. Another example, so I had this patient, he came as a heart patient, man in his 60s, 70s, following his first heart attack. For 7 years, I took him off all the heart drugs. He was suffering severe side effects, had zero quality of life. He was doing very well. He still had mercury fillings. But he somehow was a good excreter until it got to the point where he started having more angina. So for 7 years, he had great quality of life, and he started having more chest pains. I said, at the time to move your fillings. So I said, this is your thing. Remove these 2-3 fillings now from biological dentist, come back for retesting within 24 hours. After that, we're going to do the last 2-3 fillings. So they decided to save money and figured they'll just do kind of a quantity type of a deal, all right? And instead of having two assessments following each filling removal, he figured he'll just have one following the second. So he did the first one. He didn't call me, didn't show up, cancel appointment. After the second one, less than 24, that very day, he ended up having myocardial infarction and calling ambulance. They took him to the hospital, diagnosed myocardial infarction. All right. So the thing, and the reason I arrived to this because there were many other patients where clinical conditions would severely deteriorate following silver amalgam replacement done by biological dentists. So those precautions, of course, are necessary, but they're just not enough. Okay, next. All right, what we do here, so after stage 2 patient, we're still following through with the same thing. We're detoxifying, we're excreting. Now, after removing fillings, we conducted 24-hour follow-ups. Now all the fillings are removed, all right? However, this is not the time for cigar yet, all right? Because as I found with my testing, was partially concerned also in scientific literature, is not that apparently the vapor, number one, it can embed, because what is tooth? You guys know it better than what are bones. Bones is just a porous, hard substances. Think of a coral. It's a bone with a lot of holes, like a skin. So tooth is the same skin, has pores. So apparently mercury vapor embeds into those pores and stays there. And after that, we'll show you with chewing hot foods and particularly EMF, it vibrates itself out. It releases back into saliva, into digestive tract, sinuses, brains, etc. So I found that it can be embedded in teeth, in upper and lower jaws, and I didn't find any more confirmation to it. On one occasion, it was in my own head. I even found it in my cranial bones. Took a remedy, looked like, who knows. After that, I check my urine usually, the vibrational thing, and see if there is an increase in mercury release. I never would add then mercury azote in order to confuse the situation, because you don't know where it's mercury coming from your cranial bones, from the jaws, or from somewhere else. Okay, but when a patient is ready for deep detoxification, we always add mercury azote. Never use it, any homeopathic mercury things. People who have fillings, you're going to be pulling out more mercury from their fillings, so you're going to repoison them. So let's look at a couple of patients. So here, some of the documented cases here. 1994, from a biological dentist, local dentist, okay, where in the area where I used to practice. Okay, hi, Dr. Yurkovski. I did, okay, your evaluation by kinesiology of residual mercury. Now, in some cases, not only embedded mercury vapor, but sometimes depends which dentist did it, particularly conventional dentists. Don't think much about it. I think the patient is hysterical. I'll just remove fillings, do it quick. We don't want to clean up too deep to crack the tooth. All right, I'll just do it, this, that, and they would. Sometimes they can move speckles of silver amalgam fillings under the new fillings. And unless you test and find it, the patient is, again, doomed for life with being repoisoned. So your evaluation by kinesiology of residual mercury in the lower right second molar area, our patient such and such has been confirmed by an X-ray showing a piece of amalgam filling embedded in the tissue. Of course, you guys also know a few things about mercury tattoos. We also remove them through homeopathic remedies from gums. Okay, you might know this fellow, Dr. Boyd Haley. This was about 12 years ago. Okay, mercury in the extracted teeth, devoid of amalgam material. All right, this is what I said. When mercury vapor gets embedded into body of a teeth. So he is reporting us to this biological dentist that tooth not only had mercury, it had it in some kind of astronomical levels. And he said from now on they're going to, adjust their equipment or equilibrate it so it would be able to find mercury, detect mercury in such high levels. Next, this is 1994. This person was a patient of mine. Happened to be on the faculty of dental school, medical school on Long Island. Professor of oral biology and pathology. He suffered from severe, we can call it neurological brain disorder. He had removed his mercury fillings. He had many chelations done at Atkins Center. He still did not feel well. I found mercury in his brain, mercury in his body, and residues of both mercury and nickel that he was both, allergic to in his mouth. So I recommended that they just go ahead and excavate that tooth and do exploratory, some kind of a dental surgery, see what's there. So here he is saying the following. Dear Dr. Yurkovski, I'd like to personally express my gratitude for this and that, for kinesiological testing and the root canal, to remove the root canal located right upper jaw, maxillary. That's where I found it. Okay. You had indicated this tooth has a primary reason for presence of nickel in my body, and also there was mercury too. I had tooth extracted on July such and such by Dr. such and such. Sure enough, the finding was correct. Upon extraction, Dr. Brass noticed that the tooth had metal crown, and after he cracked the tooth open, it was discovered not only silver mercury amalgam, but also 2 nickel posts to maintain the crown. Okay, let's go. All right, speaking of the upper and lower jaws, retaining mercury vapor, even after the mercury fillings were removed. This is a couple of just only, I have many testimonials. This is only kind of exemplary testimonials. Felt throbbing in the upper jaw, okay, following the maxillar remedy, okay. Following the remedy for maxillar to expulse mercury, to push the mercury out. I felt throbbing in the upper jaw with acid and metallic taste. Many of you know that metallic taste is kind of characteristic of mercury. Many patients report smelling the urine having metallic taste following my treatment, perhaps chelators too. So after that, see, that's acid, metallic taste in the mouth. Urine also smelled metallic. The same happened after the mandibular remedy. Another patient, concerning treating my severe acne, only the maxillary and tooth remedy helped this. And that patient had severe disfiguring, a young woman, pretty woman, dermatitis, like red cheeks, and nothing would help, no dermatological treatment. My other treatment didn't do much until I nailed this maxillary bone skin connection, and she had mercury removed way before. So in spite of mercury, silver amalgam not being in her mouth, her facial bones were full of mercury. All right, next. So the main block to mercury detoxification, again, complexity, meant being open system, other poison can enter our system, our bodies, and block other poisons from being released. So here is one of the most renowned researchers in the field of electromagnetic fields in the world, biological effect magnetic field. He's a member of the World Health Organization, International Advisory Committee on this subject, Yuri Grigoriev of Russia, academician, and this is Nobel laureate in medicine, Luc Montagnier, who also does his research with homeopathic remedy and partially with bioresonance testing. So they both attest to harm of electromagnetic fields, and Professor Grigoriev calls it the greatest danger facing humanity today, which is absolutely correct. All right. Okay, here is a scientifically documented and observed disease-producing effects of EMF on the brain and the immune system, on DNA, on testicles and ovaries, and causes anything. Alzheimer's, confusion, poor sex drive, chromosomal damage, damage to cellular physiology, cancer, brain fog, inability to concentrate. Now, the interesting thing is that look at the number of the magnitude in the exposure of EMFs in our just regular home, never mind in the offices. So it has been increased by 1,600 times, permanent increase in the rate also of producing a rate of cancer growth in human cell culture. EMF are officially considered as probable carcinogen. They call it probable for diplomatic purposes. They're just afraid to admit to this by World Health Organization. Now, what happens, and these are only, of course, only limited number of sources of EMF in our basically daily environment, from computer to Wi-Fi to iPhones, cell phones to TV, to you name it, our offices. Now, interesting thing is, so what happens is when all this electromagnetic onslaught, all right, meets these metals that we have right in our face, a few inches away from the brain. It's interesting that there are tons of studies. There are many. Even I recall Karolinska Institute in Sweden, researchers, they already said it decades ago that mercury fillings interact with electromagnetic field even before we had these computers and Wi-Fi, etc., and wireless technology, and greatly increase removal of mercury vapor from the fillings. But this is just a recent study just a few years ago, 2015, by Iranian scientists documenting increased mercury release from dental amalgam restorations after exposure to electromagnetic fields. And of course, potential hazard for hypersensitive people, pregnant women, children, basically everybody. Next. Okay, now what happens after all this, all these wasp nests start getting activated, interacting with one another. Here we have metals interacting with electromagnetic fields, also infectious agents also become flared up. They cause inflammatory reactions which increase sensitivity to electromagnetic fields. Electromagnetic fields also deepen infectious processes, which deepen the inflammation. And this whole thing goes just, it becomes one big snowball. And this is what basically the nature of chronic diseases are. So some of this, here some of the references that reflect that, including specifically mercury and silver amalgam fillings, and how they found that the population who, for example, suffer from multiple chemical sensitivity, interesting enough, they also correlated with hyper-electromagnetic sensitivity, because it is one big toxic snowball. Here also something I already mentioned, EMFs interacting with all our minerals, trace elements in the body, toxic metals in the body, including our DNA, mercury, etc. Okay, next. So one of the studies on intravenous chelation therapy, right, of heavy metals, including mercury with autistic children. I couldn't find this reference. I know I have it somewhere. I have like thousands of references at home. Have demonstrated much higher release of metals when the chelation was conducted outdoors versus indoor environment. Right. The problem is, of course, with chelation, it doesn't go deep enough. It doesn't remove metals. It doesn't remove them completely. Right. And besides redistributing them. But all this, again, all these environmental factors, particularly EMF, are very, very important right now. If you want to really detoxify from mercury, you have to pay attention to environmental EMF, patient's lifestyle, and of course, electromagnetic protective devices. Now, there are probably 1,000 now electromagnetic protective devices on the market. And the only way to pick them is everyone has nice literature, including this Memon company that I use, a German company. And the only way really to know what's what is through bioresonance testing. Testing these devices on people, and only then you know are they doing anything, they're not doing anything. Some of them are doing even worse. Some of them fill up with electricity, and they become like the generator that you charged up. And then they start spilling that electricity on the person. And that person carries this device thinking it's protecting him, and it becomes like a generator, like additional source of electricity. So we routinely, I use it all over my office, house, cars, and we routinely recommend it to patients who want to really speed up and make their detoxification process of mercury both safe and effective. There are things for Wi-Fi, for residents, for offices, for cars, for cell phones, food, etc. Next. Okay, here, why this type of a medicine is really scientifically sound. This is only one set of references from my book. That's speaking about the role of energy in regulating homeostasis. Our entire homeostasis physiology is basically, it's energy governed. We're basically working via computers, all right? So you can diagnose the computer through electronic testing, right? And you can treat the computer or navigate it, make it, let's say, help it to get rid of viruses through so-called electronic intervention or treatment. So this is, even back then, I wrote it many years ago, already 16 years ago. Even then, and it's only limited references. There are plenty of references. Now here, going to actual bedside of patients. This is where you pick it up. This is 14-day-old baby. He develops a disfiguring rash. Dermatologist treats it, pediatrician treats it. I don't know what to do with it. The baby is returned to me. Diagnosed him as having mixed, it's mercury. Deposits in his whole body was like this. He was lethargic. He stopped eating, nursing. On top of it, once you have immunological barriers broken, he had several infections. He has staph infection and fungal infection, candida infection. So you diagnosed them, you give them this drop, that drop, this drop. It's like this is 10 days later, right? There's a baby. Now, interestingly enough, why the baby ended up with me? I treated his mom, all right? And when I treated his mom, I told mom, she was in bad shape. She was a woman in her 30s, 32 something. I said, Mom, you're in bad shape. You have to remove mercury filling. She complied. I said, you know what? We need to detox you from mercury a little longer. You're not ready to conceive. The problem is that they were trying to conceive already a couple of years. Something was wrong with husband's sperm. I'll show you what was. So they opted for in vitro fertilization. I told her, you're not ready. Your kid, I'm not only concerned about success of your fertilization procedure. I'm concerned about the health of your child and also your pregnancy course and even your delivery. Women who are poisoned with mercury, they usually don't have happy pregnancies. They have all kinds of pregnancy-related nausea, gestational diabetes, hypertension. They don't have good delivery, difficult deliveries often. Okay. And so she got upset with me because she was rushing to do it. All right. So she was rushing. She left care with me, opted for in vitro. So they concocted something in the tube, then implanted into her. Then she delivered the baby, and a week into his life, right, the baby was sick, and this was already extreme development. He started developing virtually like first week after he was born. All right, so she brought him to me. I said, hey, you said you're doing something with mercury, help us out. The pediatrician didn't work out, dermatologist didn't work out. So this is the baby. All right, here, next. This is, called incurable, right? Autoimmune disease, vitiligo. Well, there was mercury. So I pulled the mercury out of his skin. No, that's it, no vitiligo. Okay. Next, this is the husband of the mom. Okay, the man was only 30. Look at his sperm count. Okay, so he was diagnosed in that fertility clinic to see why they could not conceive the child. Look at sperm count here, 4.3 million. Norm over 20 million. Okay, so I tested him by resonance testing. Mercury in the testicles interacting with EMF. Okay, here we treated him. Here, the follow-up treatment. Sperm count from was 3.4. Now it's 12.35. Okay, and now and the next treatment. Couple of treatments after, sperm count is 35 million with the norm being over 20 million. So way into normal normal range. See, I'll show you. Okay, we'll go a few more. Okay, this fellow, right? What's interesting about him? Not only has 120 pounds overweight, eats junk food day and night, has diabetes out of control. But he also happened to be a heart patient, okay? So I picked up like 10 years before. So at the time, he came to see me after he had the first heart attack, all right? So this was his initial, before we started working, in 2003. So this is the nuclear cardiac test, mild ischemia, residues of heart attack, of myocardial infarction. And on the stress test, he developed chest pain right away, shortness of breath, abnormal cardiac arrhythmia, excessive sweating. So we did FCT, bioresonance testing, prescribed treatment, and it showed the presence of mercury bioresonance in his and tobacco smoke in his coronary arteries. So we can tune into any organ, into any tissue. We gave him the treatment. Okay, so look here. This is date, what, January 2003. The same year, 11 months later. No evidence of this, no evidence of that. Normal this, normal that. On exercise stress test, complete normal. No chest pain, no shortness of breath, no symptoms. But make matters worse, he was working, he has many kids, and actually Wife doesn't work, so he had to work like 2-3 jobs. So the only way he could sustain that crazy pace and load is by eating junk food and drinking Coca-Cola. So naturally he became obese, developed diabetes, but in spite of that, interesting enough, he should have been already dead. Look what happened after, in year 2012, he was catheterized in Heart Institute on Long Island because he had a chest pain, all right? And the chest pain, and they did cardiac catheterization. They found all his arteries clean. This is his report. Unremarkable. So forget all the cholesterol theories. If you pull the mercury out and heavy metals from the lining of the arteries, nothing's going to stick there, okay? Cholesterol is just a glue, just sticks to where it can stick. But if the arteries are healthy and normal, there's nothing to stick to, that cholesterol has no meaning. Okay, next. All right, this is, we're dealing with the patient glioblastoma, kind of serious tumor, right? It's the most fatal, deadly tumor of the brain, still remains. It's a U.S. war veteran. Now, he confirmed just about all the bioresonance testing. The finding, I found a whole bunch of chemicals, including mercury, also in his brain. Okay, this is you may not be able to see it, but he was treating Memorial Sloan Kettering, immune therapy, this therapy, radiation, nothing ever worked, okay? He continued having headache, seizure, poor energy level. This is the first time after I started treating him that they report that the tumor arrested, stabilized. Second, follow-up MRI scan of the brain, and it's probably hard for you to read this. Maybe you can get a recording of this, you review it on YouTube. It showed the tumor has shrunk, the lesion has shrunk. Following this, interestingly enough, on the treatment, he got into such a great shape that, number one, he's full of energy and got engaged in some kind of a Spartan, some kind of a sadomasochistic sports program. He's former Marine, where he was running in the mountains for miles. Two, he completely abandoned my precautions, went back to computers, using them. I said, stay away from visual devices. We cannot combine cancer in the brain with treating cancer in the brain, and you're sitting in front of actually X-ray machine day and night, okay, and treating it successfully. Things you cannot poison and repoison. Nothing is a magic rod. It's one of those things from lower systems and complexity. You don't just look at what you're doing, you also have to look what else from the environmental lifestyle of the patient is entering his body. So anyway, following this, he went to this 40-hour computer use. He deteriorated. He stopped my treatment because he didn't want me to yell at him for using computer. Then he went to Sloan Kettering and some kind of a expert in alternative medicine there, told him to go, instead of coming back to me, told them to go for ketogenic diet and ozone therapy and continue their immunotherapy, this and that. So I warned his wife, we're looking at the tragedy in the making. He's going to die. Several months later, he died, unfortunately. Unnecessary. I don't know whether he would have cured or not, but all I know, we produced a good in black and white progress, and the man was doing very well. So next, what is this? Okay, this is another cancer patient just of mine. Again, these are clean cases. I don't mix chemotherapy and my treatment and surgery. It's basically a clear-cut case. Okay, this woman was in some alternative treatment that stabilized her cancer. There's no really effective chemotherapy for her. But she was still doing very poorly, fatigue. She has metastasis to the liver, and they were remaining stable. But here, after about 3 treatments of mine, here, as I said, her basically metastatic lesions are changing from solid to cystic. They're getting liquefied. This was, I think, July 31st this year. Okay, here, this is a woman. Again, I told you this system from geriatrics to from pediatrics to geriatrics. Everyone is poisoned. Okay, primarily with mercury, plus you add a few more poisons. Okay, and that's where you have all the diseases. This woman is in her 90s now, my oldest patient. Have many patients, 70s, 80s, don't take any drugs. She takes only one inhaler because she wants to drink vodka every day, which is okay. She's single, so she needs it for emotional, whatever, health, which is okay, so we mitigate it. But telling you her story, 14 years ago, the age of, in the 70s, she couldn't even walk a few steps without shortness of breath. Seeing all the best pulmonology specialists in the city, taking tons of drugs, okay? So after we cleaned up her body, 3 years after, she went to, I never heard such a country, Bota, somewhere far Asia, Southeast Asia, to climb mountains. She was hiking in the mountains. She has today in the 90s exercises every day, has absolutely unlimited lifestyle, and just enjoying life. This is her photo from New York Times because she is some kind of very famous. She was a former professional opera singer, sang with Pavarotti. She also was a big Broadway star. So this is a photo from New York Times. So again, from pediatrics to geriatrics, everyone is poisoned. If you know how to depoison them, yeah, you substantially improve their quality of life. You can treat just about any disease. I have right now in progress a few. I don't specialize in anything. I just treat anything based on the cause and ability to treat mercury. Well, so right now I have very encouraging treatment progress with Parkinson's disease and other conditions. Here, so again, we are back to complexity. Now, if we have, I'm not against chelator, if we have a capable chelator, you can always make something good better, okay? And so I'll be happy to add it to this system, but it has to be done in a safe fashion and guided by the necessary and exact information to know how much of a chelator, how little, what it is doing, what it is not doing, and why it is necessary and when. Looks like a last slide. So this is what is one of our students, happened to be a British biological dentist with 30-year experience in alternative treatments. So she tried many alternative treatments over the years, including for mercury detoxification. She found FCT. This is an unsolicited book. I didn't ask her to write this booklet. We have it at our booth display. So she wrote her experience with FCT. So if anyone is interested in this training, we're giving a next session next month. It will be the last for this year. So you can contact me at our booth, exhibitor booth, and we'll have more